The heart's muscular pumping chamber, the left ventricle, marks the beginning of the aorta. The aorta is the largest artery in the human body. It is divided into 4 sections: ascending aorta, aortic arch, descending thoracic aorta, and abdominal aorta. The ascending aorta supplies oxygenated blood to the heart through the coronary arteries. The aortic arch rises over the heart and branches off into vessels that supply blood to the head, neck, chest, and arms. The descending aorta brings blood through branches to the ribs and chest structures. Lastly, the abdominal aorta starts at the diaphragm and then splits to become the paired iliac arteries in the lower abdomen. Most major organs are supplied blood through branches of the abdominal aorta. Similar to all arteries, the aorta has 3 layers in its walls: intima, media, and adventitia. The innermost layer, intima, is a smooth surface for the blood to flow across with low turbulence. The middle layer, media, consists of muscle and elastic fibers, which aids the aorta in expanding and contracting, as a result to flowing blood with each heartbeat. The outer layer, the adventitia, serves the purpose of support and structure for the aorta. One common malfunction of the aorta is abdominal aortic aneurysm, defined as an enlargement of the aorta of at least 1.5 times its normal aortic diameter, or larger than 3 centimeters diameter in the maximum transverse dimension. It is concluded that AAA is caused by the destruction of elastin and collagen in the middle and outer layers of the aortic wall. It is also caused by thinning of vessel wall and transmural pressure of lymphocytes and macrophages. A common symptom of AAA is widespread atherosclerosis through the vasculature. This is defined as the buildup of plaque or fatty material in the intima of the aorta. Aneurysms, however, are only formed in specific locations, and the diameter of the aneurysm is the determinant of the risk for rupture of that portion of the aorta. The development of AAA can be due to several reasons, including age, smoking, atherosclerosis, and hypertension.
The following loading and mechanical parameters are from the native tissue of healthy patients ages 50 to 70 years old. Normal yield stress is about 1.21 newtons per millimeter squared. The elastic modulus is about 210 to 430 kilopascals. The max shear stress for a healthy individual is about 1.4 dynes per centimeter squared at the infrarenal level, but could also increase to 20 dynes per centimeter squared during exercise. The normal wall thickness of a healthy patient should be less than 4 millimeters thick. The diameter is considered normal if it's less than 3 centimeters thick, but it also depends on age, sex, and physical workload, and it increases at about 1 to 2 millimeters per year. The length of the abdominal aorta is about 13 centimeters, and the graft should cover the abdominal aorta starting from just above the aneurysm to a short distance after the aneurysm, depending on the preference of the surgeon.
Current gold standards for the material used as the vascular conduits are Dacron, technically called polyethylene terephthalate, which is a textile polyester synthetic graft, and PTFE, technically called polytetrafluoroethylene, which is a non-textile synthetic graft. We recommend PTFE as it's more commonly used, but it is based on the surgeon's preference. There are 2 methods of surgery. One, called EVAR, or endovascular aneurysm repair, which is typically used for high-risk patients unable to withstand possible post-op infections. But the current gold standard is still open surgical repair, typically used for low-risk patients under the age of 70.